If you're a millennial like me, you should be up in arms about this. I'm a healthcare policy analyst here at the Ayn Rand Institute. And one of my jobs, main part of my job, is to research and comment on all sorts of government healthcare policies. Since Obama has been elected, the government has passed many policies that are actually very bad for my generation. Bad for our futures, bad for our prospects, bad for our lives. And no contest, the biggest one is ObamaCare, Obama's signature legislation. ObamaCare is a real impediment to people in their 20s, in their early 30s, what they call millennials. What is life about in this stage? I can speak for myself. It's about finishing school, getting a job, going out into the world, exercising your independence, and really try to build the world that you wanted to build, really your whole life, right? It's the first time you're able to go out there and build the life you wanted, to pursue your goals, chase your dreams, try to make it all a reality. Obamacare, as we'll see, is an impediment to all of that. Most of the law is, well, the Secretary of Health and Human Services should decide this, and the Secretary of Health and Human Services should decree that. And so over the last 4 years, Obamacare was passed in 2010, they've been writing pages and pages of regulations. And so really Obamacare is around 20,000 pages. So it really impacts everything in our healthcare system: patients, doctors, drug companies, hospitals, you name it. But the crux of Obamacare, the main scheme, the center of it, has to do with making changes to health insurance. Insurance companies, right, are no longer allowed to say no if you apply for coverage. They can't turn people away. And not only do insurance companies have to offer everybody a policy, if you apply, you're guaranteed a policy by law, but if you happen to be sick, if you happen to have existing medical conditions, pre-existing conditions they call them, you can't be charged any more than a healthy person. So insurance companies have to offer you coverage, and they can't charge you any more if you're sick. The second big part of Obamacare's central scheme is, as I'm sure you've heard, the individual mandate. This is the mandate that requires every American, almost every American, to carry health insurance. And it makes it illegal to not carry health insurance. And it went all the way up to the Supreme Court 2 years ago, and the Supreme Court did uphold it. Now, what were they trying to achieve? What was the goal behind these new regulations, these new controls? Well, we were told that, well, look, healthcare is really expensive. Health insurance, right, which is how most of us pay for healthcare in this country, that is really expensive for people. If you're older, if you're less healthy, if you do have existing medical conditions, it's especially tough. You might get a policy, you might not. If you do, it might be more expensive than you would otherwise prefer. And that makes it hard. And we were told, okay, these people need health insurance and they're not able to get it. They're not able to get it, but they need it. And so what young people need to be doing is paying for this coverage, this health care, this health insurance that older, less healthy Americans want, can't pay for. Young people should be doing it. They shouldn't be paying entirely for older people, but they should be paying a substantial portion of these medical bills, of these medical premiums that some Americans certainly cannot afford right now. Obamacare says insurance companies have to administer that. So that's why they can't turn anybody away now. They have to accept everybody, give them coverage, and then the cost of that coverage gets punted to young people. And it gets punted to young people by young people having to be overcharged for their health insurance. Around 18 months ago, there were reports of this phenomenon called rate shock. Premiums for young people, for millennials, for people my age, are 2 times, 3 times, 4 times higher than what they were before. And it was this really big shocker, like, oh my God, what's happening? But this was what Obamacare required. Young people, they don't have as many medical expenses. Compare a 20-year-old to a 60-year-old, you have 6 times higher expenses based on your age alone. That's just a fact. The government knew that, okay, if we're trying to get young people to buy this overpriced insurance, what if they just don't? It's not a crazy thing, right? Well, we can't allow that because that's what's happening now. That's the policy. That's what we're doing. So you have to buy insurance. There's not an option. It's illegal now. Well, the fact is, right, that the money that you're earning through your work, and when you're a millennial, most of us are not earning that much, but whatever you're earning is what you need to make the most of your life, to build the life that you've wanted. That's what you need. You need money to make the values you're seeking a reality, to achieve them. All that comes second. What comes first is what the government decides society needs from you. Some of you probably have student loans. Some of you may dream of being your own boss one day, of starting your own business, of being an entrepreneur. That comes second under Obamacare. There's a front page article in CNN this week talking about how millennials in particular are having more trouble than ever buying homes. Part of the reason is they're not able to save. They're not able to save the down payments required. Obamacare means if you want to save for a down payment on a home, that comes second. All of the pursuits, all of the goals that young people have, that millennials have, want to see another country, want to get a better car, want to move into a safer neighborhood, even something simple like wanting to fly home for Christmas. Obamacare is about the idea that it's built on is sacrifice. Sacrificing the goals, sacrificing the dreams, sacrificing the priorities, the lives of young people. Now, I want to say, when did this become okay? When did it become right, permissible, to view a segment of the population as if their lives are disposable, to treat them like they're beasts of other people's burdens, like they're means to other people's ends? This is supposed to be a country, right, in which each of us has an inalienable right to pursue our own happiness, to pursue our own lives. Inalienable means nothing. Nothing comes before that. Nothing can take importance above that. Nothing can override that right. And Obamacare says, no, you don't have the right, millennials, to pursue your own happiness. Your duty is to sacrifice that pursuit. Sacrifice it for society's needs. And right now, society needs you to be paying the medical bills of everyone older than you. So there's this song by Frank Sinatra called My Way. I don't know if all the millennials have heard it, but you should hear it because I like it because it's Frank Sinatra, but it also has a good message. And I love that song because it's about a guy and he's at the end of his life and he's talking about his life and what it was like and the good things that happened and bad things happened and he made mistakes and he learned and he experienced happiness and joy. But he says, what's more important than all of that, what's more important than this, he says, is that I did it my way. That I was making the decisions, that I was deciding for myself what was good for me, what was bad for me. I was thinking about it and I was experiencing life according to my own principles, living according to my own way. Obamacare is hostile to that kind of decision making, to you being able to decide for yourself how best to spend your money, on what to spend your money, when to spend your money. There's a principle at stake here. There's a principle that Obamacare's proponents were acting on. You're your brother's healthcare keeper. You're your brother's healthcare provider, your neighbor's healthcare provider, whoever they say, doesn't matter. You're his healthcare provider. That if your neighbor needs healthcare and he cannot afford it, he cannot get it, it's your responsibility now to sacrifice your own desires, drop everything, pay for his healthcare. There's a whole bunch of services that Obamacare requires you buy coverage for, and it's gone on before Obamacare. The states have been doing it for 50, 60 years, and there were over 2,000 mandates required in effect before Obamacare. So men were forced to buy coverage for birth control, not because they need it, but because to subsidize the women who do use it, right? Bachelors required to buy coverage for in vitro fertilization. If you don't drink, you have to buy coverage for alcohol rehabilitation. If your kids are grown, you have to buy coverage for pediatric care. So sacrifice is the name of the game in American healthcare, and it's been that way for a very, very long time. What American healthcare needed before Obamacare was to be deregulated, for the sacrificial programs in place, for those to be repealed, to be ended, to be phased out. What we needed was to move towards a system of freedom, to hold the free market as the ideal, not holding the ideal as massive sacrifice. Now, there's a lot to say about a free market, and there's a lot to say about what healthcare would look like and everything like that under a free market. But the key characteristic of a free market, the reason I say it's the ideal, is because the virtue of the free market is that nobody is sacrificed. Nobody's forced to sacrifice. People are left free. They're left free to pursue win-win relationships. If you think somebody's offering you an insurance policy that's not a great deal for you, you don't have to buy it. You can go and seek greener pastures. If you're paying for someone else's medical bills, if you're helping somebody out, it's because you want to do it, because you decide, yeah, my life is better if I help this person get on my feet. Free market is about people being able to pursue their own lives. But instead, what we got was Obamacare. Instead, what we got were fresh victims. The greatest tragedy as I see it, particularly because I am a millennial, is that young people today, people my age, still don't see Obamacare for what it is. So don't let Obamacare's proponents confuse you, because they try and they have to. Obamacare is about sacrificing millennials.